Howdy, everybody. We have a great show today. I want to thank you for joining me on my Poop Tip Tuesday. We have a lot of great topics we're going to talk about. We'll talk about flaming hot Cheetos. Is this bad for your gut? Can it cause an ulcer? We'll talk about more about ulcers, what causes them, and what can cause some issues as well. Are energy drinks safe? And we'll talk about why you may have to endlessly wipe after a bowel movement and more in today's live video. Guys, let us talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. All right, guys, so for those of you who are joining for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. My passion, like I mentioned before, is to give you the best tips and tricks to help out with your health. Big favor, let me know if you're watching live or on the replay, and also let me know where you are watching from. And if you have a question for me, don't forget to put it in the comments. I'll answer those questions live. Max, it's great seeing you. Sean, it's great seeing you as well. Mona Lisa, it's great seeing you guys on the live videos. And Wayne, great seeing you as well. Guys, so I have a lot of great topics today that I listened from you. If you want to give me a video or give me a topic and you don't feel comfortable posting a live video, send me a DM, send me an email, subscribe to my weekly newsletter where you can get the best tips and tricks, and you can send me a direct email and I can answer those questions as well because we're having a great Tuesday. So let us start off with the first question. Hey, Dr. Islam, can flaming hot spicy Cheetos cause gut issues and an ulcer? Very common question. I actually get this a lot. In fact, I have a lot of parents who ask me this question because they have kids who are going crazy over these flaming hot Cheetos. It's the same thing in my family as well. We actually had to ban the Cheetos because it caused a lot of our kids, excuse me, to get very, very sick. And so we actually had to prevent it from our house. So what is going on? So back in 2018, a rapper got hospitalized for possibly vomiting blood from hot Cheetos. If you look on the internet, there's so many stories of people getting sick, having stomach pains, issues, and vomiting blood, and also pooping out what seems to be blood as well. What is going on? Well, that red dye and that hot Cheeto can make it very worrisome whenever you're eating that because it's red, and whenever you eat food that's red, it'll come out as red. Same thing with beets as well. And so if you're eating red hot Cheetos and all of a sudden you vomit, it looks like you're vomiting blood, or you end up having a bowel movement, it can look like it's bloody as well. And those are things that should not be ignored, and these are things that should not cause any issues. But what is the real problem with red hot Cheetos? So we know that the spice in the red hot Cheetos can cause a lot of irritation in your stomach. It can cause what's called gastritis, which is inflammation in the stomach. And inflammation can really cause a lot of gut issues, pain, nausea, indigestion, just not feeling very, very good. It typically will not cause an ulcer though, and that's an important thing to realize. Just because you're eating some spicy foods or foods that have ingredients in them that can irritate your stomach, there's no evidence that the red hot flaming Cheetos themselves will cause an ulcer, though it may look like you're having an ulcer because you may be vomiting some blood. But there are other ingredients in those flaming hot Cheetos as well that can irritate your stomach, including a lot of these spicy substances like I mentioned before, citric acid, and MSG. These are ingredients that commonly and often really causes gut issues, causes pain, causes ulcer-like symptoms, and it can make you feel really, really bad. However, there is no evidence that flaming hot Cheetos, that in and of itself, will cause an ulcer. But if you are worried, make sure you take a look and make sure you see your nearest healthcare doctor to make sure nothing else is going on with there. All right, so question number 2. Now we talked about ulcers. What do you need to know about stomach ulcers? So we talked about how flaming hot Cheetos do not cause stomach ulcers. Excuse me. It can cause a little bit of inflammation called gastritis, but what typically does cause ulcers? The most common reason for ulcers are basically two main reasons. One is a bacterial infection called H. pylori. H. pylori is a bacterial infection inside the stomach that can cause irritation, inflammation, and can cause ulcers as well. In fact, this is one of the more common reasons to have an ulcer. Number two are medications, so things like Aleve, naproxen, ibuprofen, Advil, even aspirin. Excuse me, guys. At very high doses, and also cause an ulcer to form as well. Now, the symptoms from an ulcer can very commonly mimic gastritis, pain, nausea. It hurts really, really bad even after that you eat. And for some people, you actually may be vomiting blood or having black stools. And if you have that, that is a very concerning sign that you could be having a bleeding ulcer. So if you're worried that you may have an ulcer, what do we do? How do we diagnose it? The best way, in fact, the only way to really diagnose as an ulcer is to do what's called an upper endoscopy or an EGD. This is basically where we use a very small camera, take a look inside the upper GI tract, and see exactly what's going on. This will allow us to literally see an ulcer and possibly treat it at that time. Imaging, like a CAT scan or an X-ray, will not allow you to see an ulcer in most cases. Blood tests as well will typically not allow you to see an ulcer. The best way for us to see an ulcer is actually take a look with an upper endoscopy. And if we see an ulcer, we have to see if we can fix it. Sometimes at the time of the procedure, we can do some treatment to maybe heal up that ulcer. You have to stop the offending agent. So if you're taking Advil, ibuprofen, medications like that, you should stop that. If you have an infection like H. pylori, we'll have to give you antibiotics for that. And for the vast majority of people, we have to put you on some sort of acid medication to help suppress the acid, control the ulcer, and prevent that from bleeding. So this is basically all you need to know. Now you guys are ulcer experts. This is what you need to know whenever you have an ulcer. Linda, it's great seeing you from North Carolina. Anthony, it's great seeing you as well. Carol, it's good seeing you as well. And Deanna, it's good seeing you guys as well. And I appreciate that. So let's see. So Wayne, I want to put up your question because you have a very good question. So are there other options, Wayne? Question: are there other options for a pre-prep for a colonoscopy instead of the nasty stuff you have to drink? And sometimes you just can't keep it down no matter what. Yes, Wayne, there are. So we do have different options for the prep. All right, I'll be honest with you. And you know this, I know this, the prep sucks. It sucks. It's terrible for a lot of our patients. Some of you guys may have known at the time when we used that big gallon of Go It Lightly, you had to chug that down. It didn't feel very good and it didn't help out at all. We now have better options for a bowel prep. We have low volume bowel preps. We have preps that you can use with Gatorade and Miralax. We have a lot of options that are out there. So I don't want you to be scared to get a colonoscopy just because of how terrible that prep experience may have been for you or someone that you know. We have a lot of options that are low volume, that work just as good. And we can also give you some anti-nausea medications as well to help out with that. Wayne, that is a great question. All right. Question number 3. Hey, Dr. Islam, are energy drinks safe? Let me know in the comments if you drink energy drinks consistently, if you've had issues with that, or what your experience has been with energy drinks. Me, myself, I typically don't drink that because of all the side effects, though I do drink coffee. So we know that energy drinks are the second most common daily supplement besides vitamins. There are so many people out there that use energy drinks to either get them more energy, get them energized, maybe get them more focus. And it's such a big industry in terms of hype, in terms of marketing, and to try to convince you that you need to have these drinks to function for an everyday life. There are 2 main types of energy drinks. There are those small little energy shots. You can just squish them. And there are those 16 ounce or 18 ounce energy drinks like the Monster drinks or drinks on the same rack as Coca-Cola and Sprite as well. So what is kind of going on there? Caffeine is obviously the main ingredient when it comes to these energy drinks. The vast majority of that drink that you're having is purely caffeine alone. So 1 shot of those energy shots can be up to 100 to 200 milligrams of caffeine. Do you think that's a lot? Well, let's compare it. Those energy drinks can range from 70 to almost 300 milligrams of caffeine. All right, we know the numbers. Let's compare this to coffee. Guess how much caffeine is in coffee? Just about 100 milligrams. That's it. So 1 little shot of an energy drink can be more than double an 8 ounce coffee. What about in Coke? Coke has about 35 milligrams of protein. So one 8-ounce Coke compared to, or one 16-ounce Coke compared to a 16-ounce drink, you're almost getting 3 to 4 to 5 times the amount of caffeine from that. And so we wonder, what are some of the side effects from that? The biggest issue that you know is that you can get really jacked up. You can get shakes. Your heart can palpitate, go very, very fast. And because of that, you can get problems with your heart, maybe even heart failure as well. You can get a lot of anxiety, a lot of sleep problems, a lot of issues with your gut as well. I have so many patients who take energy drinks that have massive diarrhea, massive heartburn, massive belly pain because of all the caffeine that's in there. That caffeine will stimulate your gut, cause things to move faster. In addition to that, caffeine will open up that valve between the esophagus and stomach to cause worsening heartburn. But the other issue is that whenever you combine those caffeine drinks or energy drinks with alcohol, and that's where we're seeing a lot of the problems occurring. Because what's going to happen is that there's 4 times more likely that if you combine the energy drinks with alcohol, that you're going to binge drink, and you're going to have all the consequences from that, whether it's reckless driving, whether it's a DUI, whether it's driving without a seatbelt or driving drunk. There's so much evidence to suggest that the combination of an energy drink plus alcohol makes you do a lot more riskier behavior, because you aren't feeling as sluggish whenever you're having the energy drinks. You actually drink more alcohol than what you can typically tolerate. And I've had patients who come to me in liver failure because of the amount of alcohol that they drank in combination with those energy drinks. And lastly, obviously we know that a lot of these energy drinks have a lot of sugar as well, which can jack up your diabetes, mess up your health, and cause a lot of gut issues. And so I typically do not have energy drinks. For me, I've noticed that I've had really bad side effects from that. I would encourage you, if you are one of those that are using energy drinks to give you energy, try to find some other way, get some rest, try to get yourself off that addiction to hopefully live a healthier and happy life. Pamela, you're right. The energy drinks also make me crazy, and they make my heart go kind of nuts as well. All right, Linda, you have a very good question. I want to answer this. So Linda asks, if the food is giving you gut issues, isn't this the way your body is telling you to stay away from these food or substances? Why don't people listen to what their bodies are telling them? Linda, you are 100% correct. I love this quote. I think you are exactly right. So people always ask me, which foods to avoid, which foods to not avoid, which foods can help out with your gut. And I'll give them a list, because a lot of us know in general what foods to avoid. Processed foods, they're not going to be good for you. Spicy foods, they're not going to be good for you. Maybe even dairy may not be good for you. But Linda, you make a very good point. Every single person is different. So for me, I have no issues with having dairy. It's not a big deal whatsoever. But for other people, they know that dairy can cause an issue. And you're right, your body will tell you exactly what foods to enjoy and what foods to not enjoy. So if you're the type of person that can eat caffeine, chocolate, not have reflux, great, go crazy. It does not matter to me. But if you're like me and you have some chocolate and you're going to have reflux, then I know for me in particular, I need to avoid that. Your body is the best test to let you know what you are intolerant to. It's more accurate than any blood test. It's more accurate than any food allergy tests, which in my opinion are a waste of time. So Linda, you are 100% right. If you listen to your body will tell you what to eat and what not to eat. But for those of you guys who are confused, we are here to help you, because sometimes your body can give you mixed signals because of a lot of the ingredients that are in certain foods. So if you have foods that you're not cooking yourself, you may not know exactly what are in those foods, which can make it more difficult for you to know which foods to avoid and which foods to not avoid. But Linda, you bring up a very good point. All right. So question number 4 I got, hey, Dr. Islam, why do I have to endlessly wipe after a bowel movement? All right. Who is brave enough in the comments to let me know if this is the problem that you have had or if it's a problem that somebody else has had? I'm really curious who's going to be brave enough to really fess up to that. So this is an age-old question. I hear this a lot. And people are always wondering, hey, I have to keep on wiping. What the heck is going on? Well, there are 5 main reasons why that may be the case. Number 1 is that you could have a small little tear, or what's called a fissure. A fissure is a tear in the rectum that can come from constipation, straining very hard, maybe pushing very hard, and that can cause irritation of your rectum. It can cause that sensation of needing to constantly wipe yourself and clean yourself. Number 2 is that you can have a skin tag. Yes, you can get skin tags in your bottom. Those skin tags typically are a consequence of hemorrhoids, and that can also be a consequence of fissures as well. And that can cause irritation of your bottom and cause you to constantly need to wipe yourself as well. Number 3 is that the muscles in the rectum may not be working correctly. You may have a very loose rectum muscle causing leakage, and that can cause the sensation of having to constantly wipe and clean yourself. We do have testing to see if that's the case. Number 4, hemorrhoids. Yes, hemorrhoids can be a very common reason why you constantly need to wipe yourself and why you don't feel clean as well. And then lastly, you could have an infection in your bottom, and that infection in your bottom can cause issues, can cause itching, and can cause the need to constantly need to wipe yourself. All right, now that we talked about this, what can you do to fix this? So my number 1 tip for you, to be frank with you, is to get a bidet. A bidet is fantastic. It works. It is a great option. I actually have a recommendation on my website. If you go to my website, levickgastro.com, under Dr. Islam's recommendations, I love a bidet. It is fantastic. I'm telling you, if you become a bidet convert, you will love me for this. It actually does work. Tip number 2 is that you need to make sure you wipe correctly. Wipe front to back. A lot of people do it the other way, and that can cause a lot of irritation to occur, and that can cause you to be less hygienic and cause bacteria to go in the wrong area. And then lastly, don't go crazy on your wiping. Sometimes wiping too much, you don't need to do that. A lot of people do this and they don't realize that that can cause irritation, it can cause bleeding, it can cause gut issues and make things worse as well. But my number 1 tip by far is to get a bidet. This works. This is a very effective option to allow you to use your restroom easier and also not to feel like you have to completely wipe. All right. Ahmed, it's good seeing you. Jim, it's good seeing you as well. And thank you guys for watching on the live stream. All right. Last question before any questions you guys may have. Question number 5. Is candida overgrowth real? All right. Let me ask you guys, have you guys heard about this candida overgrowth or fungal overgrowth? Because I see it all the time on ads for social media. I see people talking about a candida treatment, a fungal treatment, a treatment to get rid of some of this bad bacteria going on, bad yeast going on, how this is the end-all, cure-all for everything. Well, my job is to give you the evidence of what the actual evidence shows and not to give you hype, but to give you science behind what you may have heard about. So just in general, candida or yeast are part of our normal gut flora or gut microbiome. It is normal to have yeast in your GI tract. We typically have it in our mouth and we typically have it in our colon as well. And so this is a normal part of what is going on inside our GI tract. So if you have candida, that is there. In fact, it's normal to have yeast in your stool. And one of the things you have to realize is that if someone's testing your stool for yeast, guess what? They are full of it. 100% they are, because it is part of the normal gut microbiome to have yeast and candida in your stool. And there's no way to diagnose that if that is a normal part of your gut microbiome. Absolutely it is. Now, the most important thing about candida is location, location, location. Because candida is normal in your mouth, it's normal in your colon, but it's not normal in other places. It is not normal in your bloodstream. And if it goes into your bloodstream, there is a chance you can have a really bad infection and really bad problems from that. You can actually die from having a yeast infection inside your blood. And the small intestine, this is where it becomes very controversial because there's not very good evidence that you should have yeast in your small intestine. And so for some of us in the GI world, if we see an abnormal growth of yeast in your small intestine, we actually may want to consider treating that to see if you feel better. The data is very mixed. It's very controversial. We don't know exactly what the long-term consequences are for treating our patients who have yeast in their small intestine. Now, there is no point at all, though, of treating you for this candida infection if you happen to have it based on a stool test, because guess what? That is perfectly normal. Now, I've seen other things out there on social media on if you have candida, like some sort of candida or yeast infection, you need to treat it with a low sugar diet because people seem to suspect that a high sugar diet makes it more likely for the yeast to come back. What do you think the data says behind that? Come on, guys. You know the answer. There is no evidence that a high sugar diet is going to make it more likely for you to develop a yeast infection. It doesn't make sense in terms of mechanism, because keep in mind, most of the yeast is in your colon and you digest in your upper GI tract, so all that sugar is really not going to get into your colon. And there's no clinical evidence that putting patients on a high sugar diet is going to make them more likely to develop this yeast, or putting them on a low sugar diet is going to make them less likely to develop their yeast. So no evidence whatsoever. So in summary, yeast is normal in your stool. There is controversy about whether it's normal in your small intestine. And if we see it in your small intestine, those of us may consider treating that, though the evidence is not all the way there. All right, perfect, guys. I want to thank you for watching today. Huge favor, if you like this live video, don't forget to smash it, like that button, share, subscribe, and if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks like you're learning in this video. But I hope you guys have a happy Tuesday. I want to thank you for watching. I look forward to seeing you guys next week, and send me more questions so I can answer them on the live stream. Hope you guys have a happy and healthy day. Take care, everyone.